Hello, everyone, and welcome to our question lab. Happy to have you here. Today, we will be doing questions on neuropathology. So before we get into our question dissection, I want to make some introductions. My name is Sean. I've been with RX Coach for a little over a year and a half, and RX Coach is our new one-on-one tutoring program, and you'll hear more about that a little bit later today. Joining us are some wonderful panelists, and they're here to help answer your questions. And if you look at your GoToWebinar control panel, you will see a question box, and you're able to submit your questions there, and our panelists will do the best they can to answer all of your questions. Our first panelist today is one of our RX coaches, and that's future Dr. Kasia Bornstein. Kasia.
Hi, everybody. Very, very nice to be here with you today. I've been with RX Coach for just about 6 months. I work with medical students who are mainly studying for their USMLE and COMLEX, Step 1 and Step 2, and trying to get people to reach their dreams. So really enjoy it, and I'm excited to be with you tonight.
One person I did not introduce is Mr. Jeffrey Downey, and I'll turn it over to him so he can introduce himself and get us started this evening.
Well, thanks, Sean. This is Jeff Downing. I am the Director of Product here at ScholarRx and USMLE-Rx, and we are ready to get this started tonight. So let us jump into it with question number 1. Now, when we go to the this slide, you're going to see one thing is missing. You're not seeing the answer choices. And that is by design. We cover up the answer choices as part of our first step. We don't want to guide or kind of begin dictating your thinking too early. We also don't want you to spot an answer choice that you're completely unfamiliar with that may cause you to panic. So we start by covering up those answer choices. And then we begin by asking the lead in first. We ask that question first. Look at that so that you can begin to focus. So the lead in here is, which of the following additional physical findings is most likely in this patient? So let's read the vignette. A 75-year-old man comes to his physician because of a 2-hour episode of being dizzy, nauseated, and unstable on his feet. He has a history of hypocholesterolemia and hypertension. The exam reveals absent pinprick and temperature sensation on his right face and left trunk and limbs, ataxia of his right extremities, left beating nystagmus, and hoarseness. So, again, the question, which of the following additional physical findings is most likely in this patient?
Excellent. Thank you, Jeff. So the first thing we want to do is figure out how many steps you think this question is going to require. So an example of a 1-step question is when they ask you for the diagnosis. An example of a 2-step question is when they ask you what is the treatment for a diagnosis. And an example of a 3-step question is what is the mechanism of action of a treatment for a diagnosis. So with those examples in mind, please let us know how many steps you think this question will require by inputting your response into the question box. And we'll give you guys a couple of seconds to submit those responses. Looks like a lot of people are saying 2 steps, and that's absolutely correct. It looks like a 2-step question, right? So first we need to really localize and identify what's going on, and then figure out what else could happen as a result. So with that thought process in mind, I'm going to go ahead and reveal the answer choices, and we will read them from the bottom up like we always do. And the reason we do that is because we want to force you to go through all the answer choices and not pick an answer choice too prematurely. So here we go. Answer choice E, right-sided ptosis and meiosis. D, inability to recognize the left side of his body. C, hyperreflexia of the left extremities. B, diminished vibratory sensation in the right extremities. And A, deviation of the tongue to the right. So I'll give you guys a couple of seconds here. I'm going to open up a poll. and let us know what you think the correct answer is. Now, some of these questions are challenging tonight, but that's okay, because we may miss it today. We are going to get it right on test day, and that is our goal. So we'll give you guys a few seconds to respond and submit your responses. Remember, on test day, there is no penalty for guessing if you don't know the answer choice, right? You're not going to get points wrong for incorrect answers, only points for correct answers. So feel free to just take a guess if you're a little lost with this question, and then we will go over the correct and incorrect answer choices here at the end. So we'll give you guys a couple more seconds to respond, and then we'll go from there. And looks like the responses are coming in. A lot of you guys are on the right track, so I'm happy to see that. And we'll give you guys a couple more seconds because I know this one requires a little bit of thinking. All right, and let's see how you guys did. Looks like it was pretty close. 30% of you guys picked deviation of the tongue to the right. And in second place was E, right-sided ptosis and meiosis. So let's see what the correct answer is. And the correct answer is E, right-sided ptosis and meiosis. And 27% of you guys got that right. So well done to those of you who got it. For those of you who didn't, don't worry, we're going to go over why that is the correct answer and why the other ones are incorrect here in just a second. So as you guys can see here, this is going to be talking about pica, and I'll come to that here shortly. So there are a lot of good clues in this question. Even though it's a shorter stem, it has a lot of info, and it's not exactly an easy question. These days, the vignettes on exams are getting shorter, which is why it's really important to pay attention, pay close attention and pick up on all of these relevant clues. We know that this patient became dizzy, right? We know that he was nauseated and unstable on his feet, had a history of hypercholesterolemia and hypertension. And then they tell us that he had absent pinprick and temperature sensation on his right face and left trunk and limb. So it's important to note here that these are on opposite sides, okay? They're on opposite sides of the body. So make sure you make note of that. He also has ataxia of his right extremities, left beating nystagmus, and hoarseness, okay? Now, like I said, it's a short stem, but it's a very dense stem, and there's a lot of clues here that you have to kind of piece together to get to the right answer. So he had all these symptoms, and after about 2 hours, he went to the emergency department. So when you read a question, always look at the clinical setting. If it's in the ER, it's probably acute and or serious, at least serious enough for the patient to seek immediate care, right? If it's in the doctor's office, it's probably not as concerning to them, and maybe it's a chronic issue or something that they dealt with in the past, or something that they don't think is too concerning. Now let's go back to the question. With neuropath questions, it's important to localize the lesion to identify the cause. Now in this question, they told us at the end that this patient has hoarseness, and that is probably one of our biggest clues, okay? It's definitely one of our biggest clues. And anytime you guys see hoarseness or dysphagia, I want you to immediately think and add lateral medullary syndrome or Wallenberg syndrome to your list of differentials, okay? So anytime you see hoarseness or dysphagia, immediately start thinking about lateral medullary syndrome or Wallenberg syndrome and add that to your list of differentials. That's because it points to a lesion of the nucleus ambiguus. Can any of you guys tell me which cranial nerves are involved with the nucleus ambiguus and are located in that vicinity? I'll give you guys a couple of seconds to submit your responses in the question box. And I see a question here. It was I said hoarseness and dysphagia. All right, and I see a lot of people saying cranial nerves 9, 10, and 11, and that is absolutely right. So in this case, the lateral medulla has most likely been affected by an infarct, and they gave us those clues by saying that he has high cholesterol and high blood pressure. And the vein or the blood, the artery involved here is actually the posterior inferior cerebellar artery. And you see a nice little diagram here of it. And as you can see here, dysphagia and hoarseness are at the top of the list of what you're going to see here. Okay, so it's important to notice that pica is associated with lateral medullary or Wallenberg syndrome. Okay, so here's the nice little mnemonic: do not pick a horse that can't eat, and that'll remind you of hoarseness and dysphagia. Okay, so what happens in a situation like this? Well, lateral medullary syndrome is due to an infarct with pica, or in pica rather. And pica supplies blood to structures of the lateral medulla, which include the vestibular nuclei and spinal cord tracts, as well as the inferior cerebellar peduncle. Now, vestibular or cerebellar damage would explain this patient's dizziness, nausea, and nystagmus. But now we still need to figure out what's going on with the right-sided ataxia. And that is probably due to an infarct of the same side, the ipsilateral side, the right side of the inferior cerebellar peduncle. Now, spinal cord structures of the lateral medulla that may be damaged will include the spinal trigeminal nucleus, which will cause loss of pain and temperature sensation in the ipsilateral face. And as you guys know, he had that loss of sensation on the right side of his face. So it would then be ipsilateral, so on the right side, okay? Excellent. So we know that the patient had absent pinprick and temperature on the right side of the face. So the lateral spinal thalamic tract then, okay, which controls pain and temperature below the neck, that will also be affected. And we know that because the patient has loss of these sensations in the opposite side, right? Loss of contralateral pain and temperature, and contralateral to the right is the left, and he has left lower limb and trunk issues. So why is E correct? That is because the descending sympathetic fibers also go through the lateral medulla, and damage to those descending sympathetic fibers could result in ipsilateral Horner syndrome. And with ipsilateral Horner syndrome, you will see ptosis, meiosis, and anhidrosis. And in fact, due to their close proximity, it's good to remember that whenever lesions implicate the spinal thalamic tract, the sympathetic fibers are usually affected as well. So a couple of take-home points here. Anytime you see hoarseness or dysphagia, start thinking about pica and lateral medullary syndrome. And whenever you think about that, also think that when the lateral spinal thalamic tract is involved, the sympathetic fibers are also affected, and that will lead to ipsilateral Horner syndrome, which is what we're seeing here. So now that we've gone over the correct answer, let's go ahead and go over the incorrect answer choices, starting at the bottom and working our way up with answer choice D. Answer choice D is referring to hemi-neglect, and this occurs as a result of a lesion to the non-dominant parietal lobe of the cerebral cortex. And this would happen if there was an infarct in one specific vessel. Can anybody tell me the vessel that is associated with hemi-neglect? We'll give you a couple of seconds to input your responses in the question box. And let's see if anybody can come up with it. And we've got several people here telling us that it's the MCA, and all of you guys are correct. It is the MCA. It's the middle cerebral artery, and that infarct in the patient's right brain would lead him to be ignorant of the left side of his body. So it's contralateral, okay? So MCA damage is associated with contralateral paralysis and sensory loss of the face and upper extremities. But hemi-neglect would not explain this patient's dizziness, nystagmus, or ataxia. So the clues of dizziness, nystagmus, and ataxia can help us rule out answer choice D. Answer choice C, hyperreflexia of the left extremities. Now that's an indication of damage to the upper motor neurons. So remember the word upper, like in upper motor neuron, and relate that with the word upper or more or higher to remember more or hyper reflexes. So damage anywhere along the upper motor neuron will lead to hyperreflexia. And since this patient presents with nystagmus, dizziness, and ataxia, we can probably deduce that this is located near the cerebellum and cranial nuclei, effectively allowing us to rule out answer choice C. Now, answer choice B. This is talking about vibration and proprioception, and nerve fibers that carry these sensations course through the medial medulla and medial lemniscus. And circulation to this area is supplied by branches of the anterior spinal artery, or these vertebral arteries, okay? And other signs of medial medullary syndrome include contralateral extremity paralysis and ipsilateral tongue deviation. And these expected findings are inconsistent with what we're seeing in the patient here. And now our last one, answer choice A. Now, deviation of the tongue to the right indicates damage to the right hypoglossal nucleus of cranial nerve 12. And that is also located in the middle medulla. So it's important here to notice and know the difference between lateral medullary syndrome and medial medullary syndrome, okay? And in this case as well, it's supplied by the paramedian branches of the anterior spinal artery. So some other things to keep in mind about middle medullary syndrome, you're going to see contralateral extremity paralysis and contralateral loss of vibration and proprioception. And this patient has a different set of findings, okay? So in summary here, an infarct of pica will classically result in lateral medullary syndrome, and manifestations will include hoarseness, dysphagia, ipsilateral Horner syndrome, absent pain and temperature from the ipsilateral face and contralateral body, along with vomiting, vertigo, and ataxia. And that's a pretty dense explanation. So I hope you guys were able to follow. It's one of our longer questions of this evening. And with that, I will turn it back over to Mr. Jeffrey Downing.
Okay, Sean, Neuropath, we are kicking it off hard tonight. That is that's definitely a tough one, and really impressed by all the comments that we're seeing here in the questions box. So that's great work, everybody. And let's jump into question 2. And again, we'll start off with the lead-in. The receptors for the neurotransmitter deficient in this illness are most concentrated in which of the following brain regions? So let's read the vignette now. A 72-year-old man comes to the office because of slowing of his voluntary movements. Physical examination reveals increased resistance to passive movement of his elbow joints, and he falls backward easily when gently pushed from the front. His symptoms have been worsening over the past several years. So again, the receptors for the neurotransmitter deficient in this illness are most concentrated in which of the following brain regions? And Sean, I'll toss it back over to you as we ask everyone how many steps you think this question is. Sean.
Exactly. Thank you, Jeff. I appreciate the assist there. Please let us know, how many steps do you think this question will require? Is it a 1-step question? Is it a 2-step question? Is it a 3-step question? We'll give you guys a second to give us your responses here. Some people are saying 2 steps, some people are saying 3 steps. So yeah, so first we need to figure out what's going on and what neurotransmitter is involved, and then where that neurotransmitter is more concentrated. And do not forget the phrase most concentrated, okay? Because that can steer you in the wrong direction if you miss it. So I'm going to go and highlight that for you here. So make sure you pay attention to that as I unveil these answers. So once again, we'll start at answer choice E and work our way up. E, thalamus. D, subthalamic nucleus. C, substantia nigra. B, putamen. And A, globus pallidus. We'll give you guys a couple of seconds here to submit your responses, and then we will go over the correct and incorrect answer choices. Let's give you guys a few more seconds here. I see a lot of you guys are falling for the trap. Don't fall for the trap. Look at those 2 words I highlighted. Those 2 words are going to prevent you from missing this question. I've given you that clue in advance, so hopefully a lot of us will get it right. All right. Well, on the test, they're not going to give you that clue, right? So you can have these challenging questions, and they can be quite specific, but don't worry. We will go over the correct and incorrect answer choices here in a moment. Looks like 71% of you guys, unfortunately, fell for it and picked substantia nigra, okay? And 10% of you guys picked subthalamic nucleus and globus pallidus. Let's see what the correct answer is. Correct answer is B, putamen. And 7% of you guys got that right. So we really need to figure out why we missed this question and how we can get it right on test day. Because those of you guys who missed it actually knew your content pretty well. That's why we were able to get the almost correct answer. But you missed just one small clue, and we're going to go over that here in a moment. So don't sweat. We're going to go over it here in a second. So as you guys know, we're talking here about Parkinson's disease, right? And we have these clues because we know that he has slowing of voluntary movements and that he has increased resistance to passive movement of his elbow joints. He falls backward easily when pushed gently, and his symptoms have been worsening over the past several years. So remember, Parkinson's disease is a bradykinetic movement disorder, which means things slow down. And it's a result from degeneration of dopaminergic neurons of the substantia nigra, But this question asked us where the receptors for the neurotransmitter are most concentrated. It did not ask us, okay, where the neurons are, and we're going to talk about that more in detail in just a second. So the main dopaminergic pathway in the basal ganglia is the nigrostriatal pathway. Okay, it's the nigrostriatal pathway. And that projects from the substantia nigra to the striatum, which includes the putamen and the caudate, where there are 2 main classes of dopamine receptors, dopamine 1 receptor and dopamine 2 receptor. And this question was asking us about those receptors, okay? So the D1 receptor is responsible for, and we refer to that as the direct pathway, and D2 is the indirect pathway, okay? We'll talk about that here in just a second. But before we continue, make a note here that the striatum includes the putamen and the caudate, and we were only given one of these as the answer choices. 2 things to keep in mind. The direct pathway, when you stimulate that D1 receptor, that stimulation will result in excitatory modulation of the direct pathway. So that excitatory modulation will facilitate movement directly, hence why we call it the direct pathway. The indirect pathway is D2, and stimulation of the indirect, that D2 receptor, normally provides inhibition to the indirect pathway, which actually inhibits movement. So the indirect pathway normally inhibits movement, okay? And D2 receptor inhibits that. So you're inhibiting the inhibitor, which as a result lifts that inhibition and also facilitates movement. So D1 and D2 both facilitate movement. One does it directly, one does it indirectly by removing the inhibition. So I hope you guys followed that train of thought. Now let's go take a look at this question again. All right, so the result of dopaminergic stimulation to both pathways results in the facilitation of movement, okay? And some of the telltale signs of Parkinson's disease are some of the ones that they gave us, right? Cogwheel rigidity is one, asymmetric resting tremor, bradykinesia, and the big one that they gave us was postural instability. So some additional symptoms we can see are akinesia, shuffling gait, decreases in eye blink frequency, and decreased facial expression. So the correct answer here is putamen, because they asked us where the receptors for the neurotransmitter are most concentrated. And if you hadn't picked up on that, you would have picked substantia nigra, missed this question, even though your knowledge was on point. So this is a very important test-taking skill to see and make sure you read the question carefully and you answer the correct question. And if you guys need help with your test-taking skills, contact an RX coach. Go to rx-coach.com to schedule a free consultation to discuss how we can help you maximize your potential and really work on those knowledge gaps and work on those test-taking skills so we can make sure that you get questions like this right on test day, okay? So now let's go over the incorrect answer choices. The thalamus. Well, the thalamus receives inhibitory projections from the globus pallidus internus via the subthalamic nucleus, and dopamine receptors involved in Parkinson's disease are located in the striatum, not the thalamus. So it's a pretty straightforward reason as to why that's incorrect. D, although the subthalamic nucleus is part of the basal ganglia, its major inputs are inhibitory projections also from the globus pallidus, but this time, as opposed to the thalamus, which was globus pallidus internus, the subthalamic nucleus receives these projections from the globus pallidus externus, okay? And these are both GABAergic stimulations. So dopamine receptors do not play a major role in these pathways in the subthalamic nucleus, which is why that is the incorrect answer choice. Answer choice C, and this is what a lot of you guys picked. The nigrostriatal dopaminergic pathway originates in the substantia nigra pars compacta. We all remember that from med school, right? But the dopamine receptors do not play a major role in the indirect or direct pathways in the substantia nigra. The neurons that release that dopamine originate there, but they extend into the striatum, and that's where they are most concentrated, and that's why this answer was incorrect. B is the correct answer. We talked about that. And A, globus pallidus, which we discussed briefly. As I told you, it has an internal and external component. It's GABAergic, okay? So it is part of the basal ganglia. And its major inputs are also inhibitory, and they come from the striatum. But in this case, we're looking for the dopaminergic receptors that are located in the striatum, and that is not what they are telling us or asking us about. Sorry, that's not what A is referring to. Okay? Excellent. So another very challenging question, but hopefully that explanation gave you some insight as to why the correct answer was correct and why the incorrect answers were incorrect. And so with that, I will hand it off to Mr. Jeffrey Downing.
Well, thanks, Sean. And another good question there. That's a tricky one. That's one you're gonna have to kind of watch out for. So, you know, it's kind of the reason we have developed RX Coach, because we want you to be able to think critically and be prepared for the types of questions that you're going to see on the boards. It's not all about the boards, obviously. There's a lot that goes into medical school, a lot that goes into preparing for these big days, but also learning how to master medical school. So we have a process that is that's proven, and we start with a 160 question assessment. So when you start off with RX Coach, your first session will be preceded by that, so that we understand kind of where you're at, where your strengths are, where your challenges are, and it will allow us to help create a personalized study plan. so for us, it's a one-on-one approach. These are one-on-one sessions. You're going to be working with RX certified tutors that have been there. They've been in your shoes. They have, performed well on their exams, but they also understand what it takes, and are keen on ensuring that you are where you need to be. One of the differentiators between us and other services is that RX Coach is able to utilize all of the products and services from USMLE-Rx. So you will have access to RX 360 Plus, which includes RX Bricks, it includes QMax, it includes flashbacks and videos, and the digital version of First Aid for the USMLE Step 1. So you're going to have everything you need. So what we definitely want you to check out rx-coach.com to learn more. You can see a couple of the testimonials here or one of the testimonials here from a student that just talked about how the RX Coach program and his tutor helped him on this on their journey. So RX Coach is here for you. We'll we've got a number of our students that are in the crowd tonight, and definitely want you to join us. We're here to help you, here to serve you, so that you can make it through this part of your journey unscathed. Thanks, Sean.
All right, thank you. So before we move on, I just want to touch on something, and that is, that question really was a challenging question. But if you picked up on those clues, you would have been able to get it right. And I highlighted half of the clue for you, which was most concentrated, but not the receptor part, because I don't want to give it away to you. On the test, they won't do that. So it's important for you to really train yourself to do a good job of figuring out what the question is asking. We definitely will help you with that in RX Coach. Now, the good news is the next two questions are not going to be as challenging as that one, right? We can only go up from here. So with that, I'll turn it back over to Jeff.
Okay, that's a big promise there, Sean. So let's see how you do. The pressure's on, everybody. Let's start off with the lead-in again for question 3. Which of the following is most likely associated with this patient's condition? So that's a question that they are asking. So let us read the vignette. A 32-year-old man is struck by an automobile while riding his bicycle without a helmet, causing him to fall and hit his head against the pavement. He loses consciousness for a few minutes, but is fully alert by the time emergency responders arrive at the scene. Upon arrival at the emergency department, the patient's status quickly deteriorates, and he subsequently loses consciousness again. His blood pressure is 158/80, and pulse is 38. The patient exhibits a slow, irregular breathing pattern. So the question, which of the following is most likely associated with this patient's condition? And Sean, we'll see how many steps is this particular question.
Yeah, so this is probably a 2-step question. I've got to figure out what's going on, what caused it. But instead of me asking you how many steps are required, we're going to change it up this time. There are 2 words in this question, that will immediately give you a clue as to what the diagnosis is. Can any of you guys tell me what those 2 words are and input it in the question box? And let's see what you guys come up with. And we'll give you that clue ahead of time to see what you guys say. What is the clue here in this question that will help you realize exactly what it is? It looks like Akshay is on the right track, Sangeeta is on the right track, Keandra is on the right track, and they're all referring to, and there we go, we got them all pouring in here, Justina, Tasha, Efferton, Mona Lisa, all got it right, and they said the lucid interval. So keep that lucid interval in mind as we uncover these answer choices. Answer choice E, thrombosis of the middle cerebral artery. D, hemorrhage in the basal ganglia. C, hematoma that crosses suture lines. B, development of cranial nerve 3 palsy, and A, blood in the CSF. All right, so I'm going to go ahead and open up the poll here and give you guys a question, give you guys a second to let us know which of the following is most likely associated with this patient's condition. Which of the following is associated with the patient's condition? Now, you didn't think I was going to ask, you didn't think the question was going to ask you what a lucid interval causes, did you? Because you have to go one more step after that. That would have been too easy. So we're going to challenge you guys a little bit, stretch those neurons out, and make sure we're pushing into the limits here as we open up your minds and teach you about neuropath. We'll give you guys a couple more seconds here to respond. I can see already that we're going to do way better than we did last time, which is great news. So keep up the good work. I'll give you guys a few more seconds to submit your responses, and then we will go over the correct and incorrect answer choices. Excellent. All right, well, it's the moment of truth. Let's see what you guys picked. Looks like C was number 1 with 39% of you guys picking hematoma that crosses suture lines. And in second place was B, development of cranial nerve 3 palsy. So let's see what the correct answer is and how many of you guys got it right. Correct answer is B, development of cranial nerve 3 palsy, and 27% of you guys got it right. And I know we're picking some hard questions, but don't worry about it. The neuropath is one of those subjects that gives people a hard time, which is why we do question labs like this. So don't feel discouraged by it. Be motivated by it, that you understood these really challenging questions. And now when you see it, you're going to think it's easy and be able to knock it right out of the park. So now let's explain and go through why the answer choice is, in fact, development of cranial nerve 3 palsy. Okay. So here's a nice little chart of the 3 different kinds of hematomas. And we already talked about how the lucid interval was mentioned in this question when they told us that he loses consciousness, right, for a few minutes, but is fully alert by the time the emergency responders arrive at the scene, and then he subsequently loses consciousness again. All right. Sorry about that poor highlighting job there. My mouse was acting up. So this patient is presenting with rapid neurological deterioration with loss of consciousness following a lucid interval. And that lucid interval is key to recognize, and we did that before we uncovered the answer choices. We also know that the patient is hypertensive, bradycardic, and breathing irregularly. Now, given that he experienced blunt trauma to the head, the most likely diagnosis is a fracture of the temporal bone. As a matter of fact, anytime you see blunt trauma to the head, I want you to think about a fracture of the temporal bone, and that will lead to a laceration of a certain artery. What artery is it going to lacerate if you have your temporal bone fractured? Anybody remember? We'll wait for you guys to put it into the question box. I have some people saying MCA and some people saying MMA, and although they sound similar, they are not, okay? It is in fact the MMA, or the middle meningeal artery, and a laceration of the middle meningeal artery will lead to an epidural hematoma. So middle meningeal artery between the skull and the dura mater. That's why we call it epidural, right? Epidural as in dura. And we have a lucid interval neurologic deterioration in cranial nerve 3 palsy as a result of this epidural hematoma, okay? So blood will accumulate between the dura and the skull, and patients suffering this injury will have that lucid interval in which they quickly regain consciousness after injury, only to deteriorate later in neurological status. And the reason why they deteriorate is because of that increase in intracranial pressure. As that intracranial pressure increases, they start to deteriorate again and lose that consciousness. So the growing hematoma is a medical emergency because as it expands and increases that intracranial pressure, it will cause compression or herniation of other structures in the brain. And with that increased pressure, the ipsilateral uncus can herniate through the tentorial incisor, leading to compression and dysfunction of the ipsilateral oculomotor nerve or cranial nerve 3. As you may remember, oculomotor nerve palsy is characterized by a fixed, dilated pupil and a down and out gaze, Non-contrast CT would be the diagnostic study of choice and will show a biconvex lesion that does not cross suture lines. So this is a life-threatening emergency, as herniation can compress the brainstem and then eventually impair respiration, okay? So the trick here is to know that this was a lucid interval associated with an epidural hematoma, blood gathered between the dura and the skull, and that can cause a lucid interval, then rapid deterioration, and is associated with cranial nerve 3 palsy. Let's see why the other answer choices are incorrect. So E, an ischemic stroke, that's due to acute occlusion of arterial supply to the brain, and patients with an ischemic stroke will present with focused and focal neurological signs corresponding to the specific area of distribution of that disease vessel. And a non-contrast study will show a hypodense lesion in the area of ischemia, but we had a clue here of trauma to the brain, which helped us rule that out. Most basal ganglia hemorrhages are also non-traumatic, so that should help us rule out answer choice D. And they actually happen to rupture of the Charcot-Bouchard microaneurysms of the deep penetrating vessels of the MCA, also known as the lenticulostriate vessels. And individuals with chronic hypertension are most susceptible to this type of hemorrhage. Answer choice C, subarachnoid hemorrhage occurs following rupture of an aneurysm or an AVM, and blood will build up between the arachnoid and pia mater, and patients will classically report the worst headache of their lives. So subarachnoid hemorrhage, worst headache of their lives. Good thing to put together and remember. And a lumbar puncture in this case will show a yellow hue, which is xanthochromia, because you'll actually have blood in that CSF, okay? B is the correct answer, we discovered it, we discussed it. A, subdural hematomas, well, they occur as a result of rupture to the cortical bridging veins, and they are more common in elderly patients, okay? And so subdural hematoma tends to be more gradual, and a non-contrast CT will show a crescent-shaped lesion that will cross suture lines. So there's a couple of things here to notice. Subarachnoid hemorrhage is the worst headache of my life, and subdural is going to be gradual onset, days to months. So great job with that question, guys. Hope you guys learned from it, and I will turn it back to Mr. Jeffrey Downing.
Thank you, Sean. This has been a good, challenging night. We're about to wrap it up with question number 4. Really love all of the engagement in the question box tonight. You guys are really locked in, and that is just as important as performance at this point. We really want you to be focusing on, understanding what's happening in these questions and how to differentiate your answers. So great job, everybody. Really, hats off. So let's look at our final question of the evening. And we'll
Jeff, before you continue, I made a little bit of I misspoke here. I stated C was a subdural. It's actually a subarachnoid. A little misspoke there, but we went over the correct information in the chart, so hopefully it didn't confuse anybody. So my apologies for that. Sorry to interrupt you, Jeff. Please continue.
No. It's good to get it right. Excellent. So, final question for the evening. We'll start off with the lead-in. Which of the following cognitive tests would best assess the patient's condition? Okay, think about that as we read the vignette. A 30-year-old man visits his physician for an annual physical. He reports that he is having difficulty finishing tasks because he is disorganized and forgets what he was meant to do. The patient's wife states that he has become more impulsive and quick to anger during the past year. His medical history is significant for a subarachnoid hemorrhage after a motor vehicle accident 4 years ago. The physical exam is normal. Again, the question, which of the following cognitive tests would best assess the patient's condition? Sean.
Excellent. So this is probably just a one-step question. You got to figure out what they're testing for and what test would work best. So maybe a two-step question. You guys probably been hearing a lot about these cognitive tests during this election cycle in the United States. So I figured it'd be a nice, relevant question to throw in there. So let's uncover these answer choices and see what the answer choices are, and then we'll give you guys a chance to respond. So answer choice E, writing a complete sentence with noun-verb agreement, recalling 3 unrelated words after 5 minutes, providing name, location, and current date, B, providing details of significant life events, and A, drawing a clock oriented to the time requested. So I'll give you guys a second to submit your responses, and then we'll go over the incorrect and correct answer choices. Before we do a raffle where 2 of you lucky winners will win access to our wonderful resources, and Jeff will announce those winners here shortly. If you guys are learning and you like these explanations, you like the way we're dissecting questions, you think that this would help you maximize your potential on test day, you want to hone in on those strengths and weaknesses, become efficient, and get that score of your dreams, visit us at rx-coach.com, schedule a free consultation to talk about our program. If you want some generalized advice, you can go to firstaidteam.com. Give you guys a couple more seconds to respond here, and then we'll go over the correct and incorrect answer choices. I see that a lot of you guys are on the right track, but just as many of you guys are selecting the wrong answers. We're hoping to turn that tide here in the next few seconds when we uncover the correct answer and go over the explanations of why it's the correct answer. Give you guys a few more seconds here. All right, let's see how you guys did. So 37% of you guys picked answer choice D, recalling 3 unrelated words after 5 minutes. And 30% of you guys picked A, drawing a clock oriented to the time requested. Let's see what the correct answer is, and the correct answer is A, drawing a clock oriented to the time requested. And 30% of you guys got that right, so great job to those of you who got it. Once again, it was a harder question, something you probably haven't looked at in a while, but it's important to know it. So let's go ahead and talk about why A is the correct answer. So this 30-year-old man, right, he has difficulty finishing tasks, right? And he also has a history of traumatic brain injury, right? He had a subarachnoid hemorrhage after a motor vehicle accident. So if he's forgetting to complete these tasks, he's also got decreased inhibition because he's more impulsive and quick to anger. So keep those things in mind. So he's got decreased working memory, leading to forgetting what he has to do, decreased inhibition, which is leading to him being impulsive, and decreased emotional control. And these symptoms are specific to what we call executive function, and the part of the brain responsible for planning, coordinating, initiating, monitoring, and working memory. So in order for us to test that, what we do is we test executive function, and it's best evaluated by the clock test as part of the Montreal Cognitive Assessment, also known as MoCA, M-O-C-A. Now, the MoCA is often used in patients with cognitive impairment, and it assesses a variety of cognitive functioning like orientation, comprehension, concentration, language, memory, and visual spatial awareness. So patients who are given the clock drawing test are asked to draw a clock face, fill in the numbers, and set the arms to the designated time, because then the patient is forced to integrate and execute multiple actions, and several cognitive areas can be assessed, including memory, attention, comprehension, visual spatial ability, executive function, etc. So the patient must gather and evaluate what is being asked, draw a circle, remember the position of the numbers, and differentiate small details such as where the hour and minute hand should be placed, okay? So good job to those of you guys who got it right. Let's go over why the other answer choices are incorrect. Answer choice E, writing a complete sentence with noun-verb agreement. So that'll assess the patient's ability to use written language, and even though that might be impaired, evaluation of the executive function is not going to be done with a noun-verb agreement assessment. Asking the patient to recall 3 unrelated words after 5 minutes, answer choice D, that assesses short-term memory. So even though this patient may be experiencing short-term memory, it will not provide information about executive function. Answer choice C, providing name, location, and current date. It also assesses orientation in recent memory, and although this might be impaired, it's still not evaluating executive function and making them put all these things together. Answer choice B, asking the patient to provide details of significant live events. That'll allow the physician to assess long-term memory, right? And even though the patient may have long-term memory impairments, it also will not provide information about executive function. So the key thing here is we're trying to assess executive function, and the way to do that is the CLOT test via the Montreal Cognitive Assessment, or MoCA. So in summary, executive function is the ability to organize and perform tasks, and that can be tested by the clock drawing test, which is an element of MoCA. And what you do is you ask the patient to draw a clock oriented to the time requested. So hopefully you guys got a lot out of today's webinar. Before I turn it over to Jeff, I do want to show you guys briefly here. This is an example of our Parkinson's disease brick. I believe we talked about that. The challenging question, once you get into the brick here, you'll see all of our learning objectives. So what we want you to take away from it as you guys do the brick, you'll see some clinical correlations, some flashcards, some mnemonics. At the end, you'll see a beautiful summary of what you should take away from that brick, along with more practice questions. And so for those of you who haven't taken a look at our different resources, I encourage you to go sign up and take advantage of our free trial where you can try out bricks, you can try out express videos, flashbacks, and our question bank to see if it's a good fit for you. So many medical students use it to their success. Our coaches have used it and they've done really well. So I'm sure it will help you also. Once you get to the end of the brick, you can actually go deeper if you want to learn more. You can go directly into first aid. You can go directly into flashbacks and quiz yourself. You can go to express videos to get more explanations, and you can go into COMLEX to test your knowledge of the material learned in that brick.